I'm Lexa Walsh. I'm a pediatric oncologist with the Center for Cancer and Blood Disorders at Phoenix Children's Hospital. From the beginning of this COVID pandemic, we've been concerned that our patients with pediatric blood and cancer disorders were more at higher risk for developing severe problems due to COVID infection. But what we've learned from our colleagues around the country and the world who have dealt with this more than we have, they have explained to us that really our cancer patients and our blood disorder patients aren't at really high risk for developing severe problems. Especially pediatric cancer patients and patients with blood disorders really need to have that ongoing follow-up, and we feel it's very important. So we're doing everything we can to make it as safe as possible for our patients. And there are some opportunities for video conferences and video visits if that's appropriate. But please keep your appointments, and if you're concerned about something, give us a call and we'll try and walk you through any of your concerns. Our department is well equipped to answer all of your potential questions. We work really closely with the blood doctors and the whole multidisciplinary team to make sure that you get the best care for your child. And that may actually be with your regular OBGYN and pediatrician, or if needed, in our department. So just contact us and we can make sure you get the best care. A lot of the medications that we prescribe in our department are very important to keep our patients as healthy as possible. We prescribe oral chemotherapy for a lot of our cancer diagnoses, and then there are a lot of other medicines needed for ongoing maintenance and the best health for our sickle cell population. So before you make any changes to your medication regimen during this time, please contact your doctor and discuss it with them, because there may be more risks to stopping the medication than there are from having a more severe COVID infection, for example. Parents can minimize their child's risk of an infection by following good hygiene practices. I know there's a lot of information on the PCH main website about social distancing and hand hygiene. In the case of our patients, we may have some additional guidelines. For example, we do want our patients who are at significant risk for a severe infection to continue social distancing maybe a little bit longer than the community at large. But check with your doctor or one of the other members of your care team if you have any further questions. If you're worried that your child may have gotten COVID-19, I would either call your oncologist or hematologist if you're part of our clinic, a regular patient in our clinic, or check in with your pediatrician. We are starting to understand that the symptoms for COVID-19 in children are much different than for adults, but usually there's a fever and some respiratory symptoms involved as well. There doesn't have to be a known exposure for us to be worried and test you for COVID. We are taking the COVID pandemic very seriously in our clinic. We're taking a lot of precautions in terms of making sure that there's nobody sick that's coming into our clinics. We do that twice, actually, at the front door and at the front of our clinics. All of our providers are masked during the clinic appointments, and we make sure that we're following all of good hand hygiene. So we're trying to educate our families as much as possible about why we're doing certain things, but I think we're really taking it really seriously and making sure that we all stay safe. So I know that it can be scary when you're worried that your family member or child may have a diagnosis of cancer or a blood disorder. And there are a lot of things in our department that can't wait until the pandemic is over, and so we are available for any needs that the community might have.